Hello, lovely lady. You are watching straight from the doctor's desk with me, Dr. Andrea Purcell, where we specialize in menopause medicine and helping you feel great in your body so that you can have the life and the health that you love. Today, we are talking about genital urinary symptoms in menopause, also known as GSM. And I just like to call it your lady parts and the hormonal effects on them during the perimenopause and menopause time of life. So if you have watched any of my other videos about menopause and hormones, I talk about menopause being a whole body change and how natural medicine is uniquely designed to help women with natural treatments, because treating the entire woman is what we do in natural medicine. We just don't treat the parts of you. It is a holistic approach. And so today's topic is all about the cellular changes that happen during menopause in the genital urinary tract. So mainly that's your urinary and your vaginal tissues, and that's what we're talking about. And we'll just call them lady parts for short. So this conversation can really be divided up into three categories that significantly can affect a woman's quality of life. So we have vaginal dryness, and nothing kills intimacy and libido like pain. We have decreased libido, which has its own impact on relationships. And then we have repeat infections, which are exhausting and defeating for a woman and require repeat medical intervention. So each one of these is its own particular concern. However, having one of these can affect the others. For example, dry painful sex can lead to more infections. More infections can lead to decreased libido. Decreased libido can lead to dryness, and so on. So what is actually happening here in the lady parts? Well, it all starts with hormones. Hormones fluctuate and change during the menopausal years, really starting around age 40. Most women don't go into full menopause till about 51 or 52. A drop in the hormone estrogen leads to dehydration of the vaginal tissue. The vaginal tissue dries out and it thins out. The thinning walls of the vaginal tissue can break down and develop micro tears. So intercourse with dryness leads to increased risk of infection and pain. As a result, we want to avoid pain. So women tend to avoid intercourse because it hurts, and then they want to cry, and that makes their partner feel bad, and that kills the libido for both partners. So the most common infections tend to be yeast and bacterial, and they can be urinary, they can be vaginal, or they can be both. Urinary tissue is very much affected by declining estrogen as well. The drop in estrogen causes the pH to change in all of these tissues, which affects the microbiome of the system. And when estrogen levels drop, the presence of healthy bacteria, also called lactobacillus, drops as well. And the lactobacillus produce lactic acid. And that leads to a change in the system, the microbiome, and tissue health. And this sets a woman up for repeated infections, pain, burning, and discomfort. It leads to many visits to the GYN office, repeated prescriptions for antifungal agents or antibiotics. So here's your takeaway. Estrogen actually keeps the tissues healthy by feeding the healthy bacteria and keeping the tissues plump and hydrated. When your estrogen drops off, the bacteria get killed off, the microbiome or the flora changes, and there's a rise in dryness and infection. And so I want to just tell you a story about a patient of mine, Darlene. She came to see me. Her vaginal tissue was so red, dry, inflamed. She can barely wear pants. Just sitting down caused such irritation. She told me the tissue was so raw that the only relief she found was just to put on a skirt with no underwear and smother her lady parts in Vaseline. Vaseline can be a good short-term fix, but she really needed some long-term relief because there was no way that she was going to let her husband near her with what she was enduring. So there are a few types of estrogen, and there are different estrogen receptors on different tissues of the body. The vagina has a lot of estrogen receptors, but specifically the type of estrogen is called estriol. So using vaginal estriol can be very safe, effective, and help you lubricate and repair the damaged tissues inside and outside. Vaginal estriol is a weaker type of estrogen, and it's localized to the tissues and is safe for most women. It is not absorbed systemically throughout the rest of the body like other stronger types of estrogen. So women will say to me, Dr. Purcell, what about using lubricant? Well, vaginal lubricants I do recommend during intercourse. Moisturizers, not hormone-based, but just regular moisturizers are helpful. However, they just don't replace estrogen and its ability to restore the proper balance to the microbiome. So estrogen replacement low dose vaginally can honestly be miraculous and healing to get a woman out of pain, boost her confidence, and help her reconnect with her partner again. So back to Darlene, after about 4 weeks of utilizing vaginal estrogen, she was happy to report that she was feeling much better. There was no more pain or discomfort. Her dryness was gone, and that she was ready to try intimacy again. In some situations, we need to treat infections along with restoring the estrogen and the estrogen receptors and the health of the tissue. So it is important to work with a trained practitioner who can help you develop a customized treatment specific for your needs. Natural medicine has a lot to offer in the realm of urinary health and preventing recurrent urinary tract infections as well. There are really some great herbs such as cranberry and good nutraceuticals like D-mannose, because long-term use of antibiotics is devastating on the digestive tract and can also lead to yeast overgrowth. So I like using natural medicine because natural remedies don't have the side effects of repeated antibiotics, and they can successfully break a recurrent UTI cycle when prescribed correctly. And honestly, I have used them successfully for over 20 years. Hormonal changes will affect the libido. It is common to see a decline in libido in menopause. Hormonal replacement can help improve libido, but really not in all women. So I like to think of sexual energy as just extra energy. So if a woman is stressed out, she's exhausted, her hormones are low, there really isn't going to be any extra energy for procreation. So libido, just like everything else in women's health, is complicated, and it's important to consider a whole body approach with dietary, lifestyle changes along with the hormone replacement. However, a good place to start is correcting vaginal dryness if it is present, and that really should be the very first step. So if you're out there and you are struggling with your lady parts, you're looking for answers and natural alternatives, I'm happy to see if I can be of help to you. You can just schedule your free discovery call with me. We can chat about it. So thanks so much for joining me today. Be sure to check out my other videos on women's health. You can find me on the web at www.drandreapurcell.com. Take care.